Mike. Thank you for being with us. Good afternoon. How are you doing today?
Very well, thank you. Thanks for having me.
Perfect. Just tell us a little bit about yourself, Mike.
So, I'm Michael Gasaway. I'm a physical therapist assistant. I've been practicing for 4.5, 5 years, mainly in skilled nursing facilities, but I've done a little bit of outpatient as well. So.
Okay. Perfect. Thank you. I know I've seen PTA, so that's what it means, physical therapist assistant, right?
Yeah. Yep.
Okay, that's the acronym. Okay.
They also see LPTA sometimes too,
LPTA.
licensed physical therapist assistant.
Okay, perfect. What's a typical day for a physical therapist assistant? What do you do?
So, it varies a little bit with the settings, but for the most part, what you do is you're in a skilled nursing facility. I'll come in, I have a schedule of people that I need to see. Some places give you a set time and to follow along. Other times they don't. But you will go and you work on exercises or transfers, a lot of different things to try to rehab people who've gone through strokes, orthopedic surgeries, traumatic brain incidences, all whole different diseases, all kinds of stuff, to try to get them back on their feet, essentially, get them back to their prior level of functioning so they can go home or to whatever level of care they're going to be going to next.
Okay.
And if on the more outpatient side, more so you'll see sports injuries, for instance, or a lot of orthopedic surgeries again, and it's really just trying to rehab, strengthen the muscles that may be affected or whatever needs to be fixed in order for this person to resume their normal quality of life.
Okay, I got you. So you said you're the assistant. So you versus a physical therapist, what's the difference?
The big one is physical therapists do the evaluations, discharges, a lot more of the paperwork. They go in and figure out basically where the problems are and then come up with a plan of care that we then follow along and execute under their guidance. They also get a little bit more in-depth with certain things in their schooling. They're allowed to do other techniques that we may or may not be allowed to do, depending on how they feel comfortable with what we're able.
Okay, perfect. So I know there are other people. I mean, I've asked this in another interview, but I want to get your perspective. As I know there are physical therapists, the occupational therapists, and there are PTAs and CODA, what is it called, Certified Occupational Therapy Assistants.
Yeah.
And I hear that there's a difference there where PTA stands for Physical Therapist Assistant, where OTA stands for Occupational Therapy Assistant. However, what is the difference in the job that you do as you versus an occupational therapist assistant?
So physical therapy, I mean, not to use the term, but it's more physical. It has to do, especially in the setting that I work in, it's a lot more of the strengthening, balance, walking. Walking's a big one. Whereas occupational therapy applies, there's also an unwritten rule where physical therapy is, basically legs, and then occupational therapy is upper body.
Right.
But we get trained on both.
Right.
And occupational therapy focuses a lot more on just daily living, functional tasks such as, toileting, personal hygiene, brushing your teeth, shaving, eating, all that kind of stuff.
Okay, I got you. Okay, great. Did you always want to be in the physical therapy business or in the field, or?
Not initially. When I was younger, even coming out of high school, I really wasn't sure what I wanted to do. I was leaning towards medical field. I started researching more careers in the medical field, and I talked with a few physical therapists that I knew. I actually have been through physical therapy several times myself. And I remember what they had me do, and I enjoyed the process of it. I always found it interesting. I love to exercise, and that's a huge part of what we do.
Obviously.
Yeah. And looking back on my own experiences is where I guess, kind of started my interest with it.
Okay. All right. Perfect. So like you said, you've given a little bit of information on it. So basically, you're going to therapy, and you being a exercise guy is what kind of contributed to getting there.
Yeah, that's been a lot of it. Part of it too, I guess I wanted to, in a sense, pay it forward. So in high school, I was an athlete. I played football. Football mainly was my big one, and I had several injuries from my sophomore year on. A major one my junior year that they said I might need surgery to fix my shoulder, and I had another friend who had had surgery, and he was going to miss the majority, if not all, of our senior season. So I said, that's not an option. So what else can I do? And that's how I actually wound up going to physical therapy. He was at the time our athletic trainer, who was also a doctor of physical therapy, had his own practice. So we spent several months rehabbing my shoulder and building strength in it to where I was able to actually play my senior year.
Okay.
So I figured, if it helped me get back to doing what I love, I can help people.
Okay.
Yeah.
Sounds very interesting. The big question: how exactly does a person become a PTA, or physical therapist assistant?
Okay, so you have to go through college. Most of the time it's a program it's an associate's degree right now. They're debating changing it to a bachelor's, but they've been talking about that for a while. But you need to go through an accredited program by the APTA, American Physical Therapy Association. And then once you have your coursework, and then you have clinical rotations where you're actually doing hands-on, out practicing, basically doing what you're going to be doing. And then once you graduate, take your board or your licensing exam, and then once you get your license, you can become a PTA and start practicing.
Okay. Talking about the bachelor's, I think I saw a school or two who are now doing the bachelor's degree in the PTA.
Yeah.
Okay.
Yeah, I think some have already moved to that.
Okay.
It might be a good thing to do because a lot of our coursework gets very condensed, and it's high-paced, rapid, I guess you want to say, where you may not get as much time practicing or learning certain topics and get to expand on them as much as maybe we should.
Okay. So, with you, why a PT and not a PT? I mean, as your stance, as you are right now as a PTA, are you debating, or are you thinking about becoming a PT? Is that an option? Is that something you're interested in, or is it really relevant to you?
It's something I'm considering. I've considered off and on since graduating. There are certain programs that you can go, especially that transition straight from a PTA. It's a bridge program. I think there's only a couple of them in the country, but go from PTA to PT in a couple of years. Whether or not I want to do it, I'm debating. It's very expensive.
Okay.
And I don't know that I care as much about the documentation. I prefer, and the way things are going, they have this push towards top of license, which is basically PTs and OTs are going to be doing mostly, what their license allows them to do, which is the evaluations and discharges, and it's a lot of paperwork. I prefer to do hands-on. They don't get me wrong; they do a lot of hands-on. They treat patients all day as well, but there's a lot more of the paperwork that I just I don't know if that's what I want to do.
So, in your opinion, is it worth it to become from a PTA, not just a person who hasn't gotten in the field yet, from a PTA to a PT? In your opinion, is it worth it? The more student loan, the pay difference, is it worth it in your opinion?
The pay difference, initially, no, because it's very expensive, and I don't know what the pay difference is. But over time, I mean, it depends on how long you've been practicing. If it's late in your career, it may not be worth it because it might cost you too much, and you're not going to work long enough to pay, make it up.
Okay.
Early on, possibly. It depends, I guess, where you want to go with physical therapy. I actually have a good friend who did in Findlay, Ohio. There's a bridge program. He did it, and he started his own practice where he's doing a lot of sports rehab, and then athletic training or athletic performance specific training. And he's actually he's training several collegiate and soon to be collegiate athletes. And
Okay.
so if you want to go that route and kind of work on your own, then it would be absolutely worth it. Otherwise, you, as a PTA, you have to have a supervising PT. Now you can still head to practice if you find one that's willing to, I guess, quote unquote, work under you while you're still working under them. But
I got you. Okay. So besides the college, that you talked about, what's the rough estimate for tuition? You said the schooling is about 2 years and it's a community college. What's the tuition like? And is there any alternative to what you just said?
So tuition, it depends on where you go to school. So you can go to state schools and it's going to cost you quite a bit of money because a lot of times they'll have prerequisites and stuff where unless you apply early and you've taken secondary courses in high school, you're going to have to take these certain courses anyway because it is very selective getting into these programs. They may have, 100 or more people applying and they only take, I think it was like 28 or 30 candidates. So they base that off of your college GPA, different courses you've taken. They all give you a score, at least is how it was at Kent State where I went. And then only the highest scoring ones get in. So you're in school for usually a year or two prior to getting into this program. And that's how it was for me, and I think pretty much all of my class. So you're going to be paying for 2, 3, maybe even 4 years of tuition, which could be 10 to. When I first started, I was at a state school, and it was, I think, $20-some thousand for a year.
Wow.
I transferred, thankfully, back home to Kent State, where they had a regional campus, which is close to home. So I really didn't have to pay much on tuition that year. But alternative routes to getting to a PTA, I mean, they all go through college of some sort. But there are athletic training programs that it's not a full-on course like I went through, but you already have you're certified to practice as an athletic trainer, and it's like a transition, kind of like the bridge program to PT. From PTA, you go from athletic trainer to PTA.
Okay. So that's the college route, the regular state college route. So I'm guessing that community college would be much cheaper.
Oh yeah, I'm sure it would be a lot. Yeah.
Okay, I got you.
You don't pay for room and board and all that stuff.
I got you. Okay. So during your school to becoming a PTA, was there anything that you found particularly interesting that made you want to do it more or made you want to quit?
So,
because I hear these programs aren't easy.
They're not easy. Like I said, a lot of it is very condensed, and actually the program that I went to, they changed the way the curriculum was to where some of our classes, which would have normally been stretched out along 15 weeks or so, got condensed to half the semester. So it's, a test or quiz every day. So it's like I said, it's fast paced, so you've got to be able to keep up. I don't know that I ever really wanted to quit, but I had an interesting experience, I guess, with my clinical rotations. I won't get into all the details because it's a long story, but I actually I got, I guess, kicked out of my first clinical rotation. It was a lot of varying, different circumstances that went into that, and I don't want to say through no fault of my own, but things got a little blown out of proportion. I got even told that by professors later on. But I wouldn't have changed the way it worked out. So I had to, because that happened, I had to redo my first clinical rotation during the summer when, everybody else is on break. And I ended up doing an outpatient clinic at that time. I had pretty much finished my first rotation. So it was 4 weeks. I was in the 4th week when this happened. So I had 4 weeks of extra experience, I guess, whereas most of my classmates did not have that. So I went into my redo first clinical with being more comfortable, and I kind of, I guess, took over from like day 2, doing most of the treatments and all that. And I ended up getting hired after graduating by that company. So it worked out pretty well for me.
Perfect.
But yeah, when that first clinical, you get kicked out of it, you have that, it's like, oh man, do I want to have to go through all this again? But no, I'm absolutely glad that I did.
Okay. Perfect. So you've talked about tuition and stuff in school, but do you think after graduating, what I'm guessing you feel is worth it? I mean, what are the financial rewards or not financial rewards that you get from being a PTA?
So financially, I mean, you make decent money, especially for a 2-year degree. You can make easily upwards, more than 50, 60 grand, depending on what kind of setting you're in.
Okay, per year?
Yeah, per year. Okay. And then non-financial gain, it is a frustrating job sometimes, but it's very rewarding. Okay. You'll have, especially like in school, I never would have thought a skilled nursing facility working with geriatric populations would be something I wanted to do. Right. And then once you get into it, and I got to experience, I love it because you get to build relationships with these people, and you see them, sometimes where they may not be able to even stand up on day one. Exactly. And they may progress to where they're walking home, and most of the time, they're very, very thankful for what we do. It is very fulfilling.
Right. So I caught a term there. So by geriatric, you mean the elderly population?
Elderly patients, yes.
Okay, I got you. All right, perfect. So I was going to ask you, but you touched on it. What that's, you said about 50, 60 grand. Is that what a new graduate is, looking at, or a seasoned therapist is looking at?
So,
or is there a cap on it that you can't really move it from there?
There's a cap, but it depends really on the setting you want to work in. Okay. Outpatient doesn't make quite as much money usually because, for one, it's a very high demand job. Okay. And it's not as, I don't want to say it's not as hard, but there's more risk with working with geriatric neuro patients, stuff like that, versus just orthopedic, surgeries. I was making roughly that when I graduated, so this is my second job. Okay. I practiced, like I said, in an outpatient. They hired me right after I graduated for a little while, and then I moved. I got this job. I've made about the same the entire time. So a lot of that has to do with Medicare and financially how businesses do, but I won't get into all that stuff. But you can make more money doing traveling therapy. Okay. A lot of times you get a stipend that they don't take the taxes out of the stipend. It's your cost of living. Right. And then you make whatever in addition to, and that's where they tax you. But a lot of times you'll make more money doing that.
Okay. Sounds good. One thing I wanted to ask.
PRN pay.
Okay. Well, PRN, you said?
Yeah, PRN per diem. So you can get in with companies or buildings where if they need help, they can call you, and the night before or morning of sometimes, and you go work a day for them, and you make more typically per hour doing that than you would if you're a full-time employee.
I'm guessing because they don't have to give you any benefits. Okay.
Yep.
Okay. You've mentioned setting a lot. How many settings are there, or roughly where can you work, or what are the settings, and how much opportunity are there?
So I said outpatient already, which is an outpatient clinic where, like I said, a lot of times it's just orthopedic stuff, but occasionally you'll have a little more neuro or whatever. Skilled nursing facilities, which are basically nursing homes, and then there's acute care, which is in the hospital most of the time, right after surgeries or right after strokes, or sometimes you'll have patients that are in the ICU during those. There's also specialized settings, like pediatrics specific. You can work in chiropractors' offices sometimes. I think that's pretty much it. Subacute, where it's kind of in between the hospital and skilled nursing facility, where they get a little bit more intensive therapy sometimes to get them up to par to where they can do what we would be doing with them.
Okay. Okay. Sounds like there's a lot of opportunity there then.
Oh yeah.
Okay. So with that, I was going to ask you about, but I think we just segued into it. I'm guessing the job security is good, as what you're saying.
Yes, I would say so. I guess I'm going to touch on the Medicare changes. Certain things have changed since October of 2019. PDPM kicked in, and
What's
the
that?
way that's patient-driven pay model. It's just the way Medicare reimburses facilities, specifically skilled nursing facilities, to where they weren't getting as much money for therapy as they may have prior. So some companies, depending on the way they're set up or what decisions they feel they need to do in order to survive, made job cuts. And it wasn't just the company that I work for now. I know several people who've had that happen throughout the country, but I friends on the West Coast that same thing happened there, because it's a national thing. But for the most part, job security, yeah, there's always going to be people who need physical therapy, especially now with the population aging, especially baby boomers and all that. There's COVID kind of put a hold on quote-unquote elective surgeries, like knee replacements, certain things like that. So outpatient settings, I'm sure we're suffering a little bit from that. But it'll come back. I mean, it's always going to be there.
Okay. Also, what you've worked for a while now. What kind of challenges are you seeing as you're going up or as you're working now?
Like in the day-to-day?
Yes, and overall, are there any challenges that you're facing?
For one, you got to deal with sometimes very difficult patients. The job requires you to have a lot of patience and understanding. You get to see maybe not the best side of people sometimes, because they're in pain, and you have to understand that. So, and trying not to take certain things personally, because you will have some mean thing said to you. It can also be a frustrating job, like I said, frustrating earlier, but frustrating when, maybe someone's not making the progress. And as a PTA, we love to help people. We want to see them get better. And sometimes that doesn't happen. And you have to have difficult conversations with families. And that's probably the hardest part of the job.
Gotcha. So from outside, some of us, like you said, you mentioned family members. We come in there and then, we expect that our mothers here, our grandmothers, should be doing better. And why aren't they doing better? What are the, from the outside looking in, what are we expect something, but what is the reality versus, the expectation?
A lot of times, families expect us to kind of be miracle workers and have people back up on their feet, that day. It doesn't always happen that way. So, especially with like strokes and stuff, families don't understand everything that goes into what happened to the person and how they may and or may not recover. It's difficult to try to explain it to them because they don't have all the training and understanding. A lot of times it takes longer for people to get back on their feet in rehab than they or their family expect. They may think it's going to happen, like I said, overnight, but it may be months or years, depending on what's going on with them.
Right. I gotcha. Okay, so I guess we should be more sympathetic towards the workers too as well. The therapists, we should not just come and expect miracles, as you said.
Yeah, absolutely.
Everybody's very different, I'm guessing. Okay. Yeah. So you've spoken with a lot of passion about what you do now. How do you think this career, if any, has shaped your life?
It's definitely helped me become a more patient person. Working with people who may not be quite so motivated, you have to be able to sit down and sometimes have conversations with them, try to get them inspired to participate and do things that they may not really want to do because it's difficult at the time. It's definitely made me more appreciative and not take things, maybe for granted that I did prior. Because I had one patient one time who was 20 years old and no use of her legs.
Wow.
So you realize that things can be taken from you at any time. So.
Okay. Do you wish you had done anything differently throughout this whole journey to becoming where you this therapist that you are now?
I don't believe so. Like I said, I love what I do. Maybe I wish I would have traveled initially coming out just to experience more settings. But I mean, I can always go back and do that. Not right now. I think COVID's kind of put a hold on a lot of traveling jobs. But once things open up, that's all, and something I'm considering doing. But we'll see where it goes.
Talking about COVID, we all understand what is happening, but how do you think it has affected the not the business, but the profession?
So we've definitely had to be more stringent on hygiene, PPE, personal protective equipment. Personally for me, we've been restricted to room treatments instead of using all the equipment that we've had available to us in the gym for several months now. So you have to be a little bit more creative with your sessions. You have to especially be able to motivate people as well, because when they're not leaving the room, they're like, why, what's the point? I don't want to do this. I can do this at home.
Right.
And you have to be able to, make them understand, this is stuff you can do at home because we're doing it in your room, but you need, this trained professional to help you in doing what you're trying to do. Mainly for safety most of the time.
Okay, I think we're right at the end of this, but one thing I'd like to ask you is, would you have any kind of advice for, let's say, high school graduate or somebody looking to do it, or maybe even an adult who has lived life and has done different things and maybe is trying to change professions and is looking at being a PTA? Do you have any advice for them?
Yeah, so for one, I mentioned earlier accredited, and this goes back to another interview you did where you want to make sure your program's accredited if you decide to go this route, because if they're not, you can't take your licensing exam. You just wasted all that schooling. But I would say try to go at least shadow if you can, a physical therapist / physical therapist assistant, whatever it is, to get a feel for what it is you're going to be doing. There's a lot of things you don't see in school that you have to deal with and have to do on a daily basis when you're practicing. That without coming into it knowing, it can kind of take you by surprise. But you have to be patient. You have to really want to help people. So if that's not something that you're willing or want to do, I would look elsewhere. But if it is, it can, like I said, it can be very fulfilling.
Sounds like it's a calling there. You have to be called to do it.
Yeah, I guess so.
You have to know how to be patient and deal with people, really.
Yeah.
Sounds like a very personable job. And
yes, interpersonal skills, you can develop them a little bit, but you kind of have to be comfortable working with people, because you're working with public every single day, nonstop. That's what we do.
Exactly. Well, thank you very much for sitting with us. I really appreciate you coming here.
Yeah, of course.
And thanks for that important and great information you gave us.
Yeah, thank you so much again for having me.
All right.
All right.